Today I'm with Mark Imisides, and he's a doctor in chemistry, and I found his view on this particular topic, current day, what's happening in the world, relevant and very interesting. So Mark, thank you very much for doing this interview with me, and tell us a little bit about yourself, and then we can launch into this information.
Okay, PhD is in analytical chemistry. Now, analytical chemistry is all about numbers. So you draw conclusions based on what the numbers say, and if that happens to be an unpopular opinion, well, too bad, that's what the facts say. So there's that side of things. Also, I've been involved in OH&S, so risk management, risk assessment, that kind of thing.
Great. And so more recently, what have the states or the affairs of the world made you sort of look at to make an understanding and informed I guess, decision about what's happening in the world?
Well, we've seen this COVID-19 thing sweep across the world. And first we're hearing horrendous stories of deaths in China and then Italy. And I watch with fascination to see what's going to happen to the rest of the world. And of course, came to Australia, and now we're seeing a mass panic and a mass lockdown. Now, before any data was available, when the government announced the closure of cafes and restaurants, it was immediately obvious to me that it was the wrong approach. From a risk management standpoint, this, without question, only attacks a very well-defined cohort, elderly people. And if the people that are being affected by a disease are well known and well defined, then that's the approach where you take an isolation strategy. And when it comes to risk management, there's a whole range of things you can do. You pick the one which has the best effectiveness with the minimum disruption on other parts of the system. It's called the systems approach. So in other words, you identify a risk, you look at the effect of that risk on the whole system, then you put in place a risk management strategy, then you reassess the effect of that risk strategy on the whole system. And you don't want a situation where the cure is worse than the disease. An example would be, let's say, road fatalities. 200 people die on the roads every year. Now, you could stop those deaths by just stopping people driving. No one can drive anymore, period. Now, no one would go along with that because it's quite obviously too great an impost on the system. So you pick a nuanced approach. And the nuanced approach here would have been isolation. Isolate the elderly and let everyone else get on with their lives.
And I guess that would make sense because, like you're saying with the example of driving, you know, it wouldn't make sense to isolate everybody. Yeah. And this is exactly what's happened, and the cost has been that it's killed the economy. And it's killed tourism in some areas that heavily rely on tourism. What do you think? I mean, is that a fear-based reaction? What would have made politicians make that decision? Is it just a knee-jerk reaction? What are my health experts telling me, and I'm just going to react on that, and not thinking about the whole consequence?
Well, the problem is they ask the wrong people.
Right.
They ask doctors for what to do, and doctors aren't trained risk managers. Right. If you go into a mine site, for example, and look at their risk management strategy, you'll find it wasn't written by a miner, written by someone like me, a risk management professional. Now, the risk management professional comes in, they speak to the miners, certainly. They talk to the drivers, the excavator drivers and so on. They get an overall understanding of all the risks on site, then they come up with a nuanced approach. So what should have happened is a risk manager would talk to the doctors, certainly get their information on the nature of the disease. Then you speak to, say, oncologists to get an understanding of the effect of lockdowns upon missed early cancer diagnoses or treatments. Then maybe talk to mental health professionals, get an understanding of the effect of lockdowns upon mental health suicides. Then maybe speak to economists, get an understanding of the effect of lockdowns on the economy.